All right, let's talk now about our big story tonight, which is actually kind of a follow-up on last night's big story. It's about keeping this pandemic out of Oregon's prisons, and that is proving to be very difficult. Now, last night we told you about an employee at the Oregon State Penitentiary in Salem who had tested positive for COVID-19. Officials across the criminal justice system, they all fear this virus spreading further within Oregon's prisons and jails, and it turns out those fears, well, they were warranted. 24 hours later now, 2 Marion County Jail workers and an inmate at the Santiam Correctional Institution have also tested positive. Now, last night, Governor Brown told Maggie Vespa she is considering using her clemency powers to release some inmates early and bring down the population inside these prisons. That would help everybody kind of space out a little bit more and keep their social distance. But tonight, we're hearing from someone new. An inmate in one of those prisons called Maggie to describe what life is like right now inside.
Did you mention at the beginning of that, you said that you had a cough?
His name is Skyler Floro. He's 23 years old, and he called from the Columbia River Correctional Facility, a minimum security men's prison in Northeast Portland. He's there serving a 5-year sentence for 2 counts of robbery. Floro says he and other inmates have been watching the news, and they're scared about this pandemic like everyone else. He is especially scared.
I have no fever, but I've had a bad cough for like a week and a half, and like shortness of breath and chest pain.
Floro told me he was checked out by medical staff who told him his oxygen levels were fine. He felt good about that, but he had a request.
I asked medical for a mask so I would not cough on other inmates because we are forced to live in conditions where we are only a couple feet apart. Because if you go through a coughing fit, our bunks are so close, it's impossible not to cough on somebody. I can lay out my hand and
KGW verified Floro's name, record, and prisoner ID number through the state system. We also took his complaints to the Department of Corrections, who told us one of his concerns is being addressed next week. Masks are coming to Oregon's prisons. These are photos of them. 30,000 total are being produced by inmates in Eastern Oregon for prisons across the state. Each inmate will get 2. Each employee will get 1. That said, another big concern is tougher to solve. Last night, the Department of Corrections chief medical officer told me maintaining social distance inside Oregon's prisons, which contain more than 14,500 inmates, is not always possible.
People have to go get their medications 3 times a day. They have to go to chow 3 times a day, which is to eat their meal 3 times a day.
As a result, advocacy groups are calling on Governor Kate Brown to use her clemency powers to bring the prison populations down by releasing elderly inmates, the immunocompromised, people with release dates already set for this year or next, and people whom DOC staff believe can safely return to society. Today, the American Civil Liberties Union of Oregon joined that call.
Not taking steps to protect people in custody from a life-threatening illness amounts to cruel and unusual punishment.
The governor says she's considering it. Meanwhile, we've learned local jails aren't waiting. Tonight, the Multnomah County Sheriff's Office tells KGW they've reduced their jail population by 30%, taking into account each inmate's health, charges, what's left of their sentences, and other factors. Abby Stamp heads up the local Public Safety Coordinating Council, a government agency that serves as a bridge between city and county criminal justice systems. She said law enforcement, judges, defense attorneys, and prosecutors are working together to figure out whom they can safely release.
When the decisions are made together where the law enforcement, DA, defense, every single partner agrees, that's a space where we feel like those are safe decisions. Those are the safest decisions we can come to.
Okay, Maggie Vespa joining us live now. Maggie, obviously prisons and jails aren't designed to be spacious, right? So we could see this problem getting out of control. Multnomah County not the only one pulling back at this point, right?
Yeah, exactly. And again, just since our story last night, we want to point out we have an image of it. Clark County Sheriff's Office posting on their Facebook, letting people that know that they've gotten their questions because people had heard that inmates have been released. And they confirmed, yes, they've released 200 inmates from their jail. The sheriff in Clark County writing they worked with judges and a prosecutor to make that call, including and released inmates who were, they said, medically vulnerable, those who were awaiting trial but hadn't yet been convicted, among other groups. And then the sheriff added, quote, "But in a nutshell, if you are a violent felon, sex offender serving a sentence for a sexual crime, or if you have an in-custody sanction or sanctions that would deem you a high risk, you will not be released. So again, a similarly kind of complicated and multifaceted decision-making process like what we've been seeing in Multnomah County. And obviously, if Governor Brown were to use her clemency powers and do this with state prisons, that brings in another layer of government, another layer of decision makers. So it kind of gets more complicated, but advocates say there's no time to waste. They point out there are staff walking into and out of these prisons every day where everybody's really confined together, and then those staff go and live among the rest of us. So their point is an outbreak in a prison would not stay in a prison. Dan?
It makes a lot of sense. Maggie, thank you so much.